Good afternoon and welcome to this session on influence of.
Welcome back, everyone. Let us now welcome the next session of the day entitled Influence of Technology and Data Kicking Up a Notch for Future Healthcare. We have an international lineup of panelists from Singapore, India, Indonesia, as well as from Malaysia. So let's talk health tech. Moderating this session is Dr. Kuljit Singh, the President of the Association of Private Hospitals Malaysia. He has been an active member in the Malaysia Medical Association MMA since 1996 and has contributed and engaged himself in various roles at state and the national level of MMA, where he also served as the Honorary General Secretary from 2013 and 2014. So over to you, Dr. Kuljit.
Thank you very much for the kind introduction, and I would like to express my gratitude and thanking the organizers in inviting me to chair this topic on influence of technology and data kicking up a notch for future healthcare. Now, healthcare is an ever-changing industry, and patients are now becoming better informed and more willing to take charge of their own health. And technology, as we see today, has played a crucial role in providing personalized care. And now we have today with us some leading world healthcare tech companies which have brought about a lot of vital innovation, particularly in Asia. Now, Asia is pretty unique in its own way because we look after a huge population in the world and we are sporadically spread. And currently, as we all know, we are undergoing this pandemic, and the high number of cases at this point of time is mainly in Asia and lesser in the other parts of the world. So we are looking at technology, how technology has helped us, how mature technology is in healthcare, and how much do we have today, and future, what kind of technology that we should have, we can imagine and we can innovate for the future. The COVID has taught us a lot of things. There are some silver lining in COVID. There is a huge usage of digitalization in all aspects. When COVID has hit us, there was a lot of resistance and hesitancy of using digitalization in healthcare before COVID. Today we can see this has changed quite a bit in the landscape of healthcare. So what I'm going to do is I will let the panelists introduce themselves, and then we'll get on with the function. So first, I would like to invite Hazwan Najib to introduce yourself.
Thank you, Dr. Kuljit. Hi, everyone. My name is Hazwan. I'm the co-founder and also the chief marketing of DoctorOnCall. We are based in Malaysia. We started off in 2016 as a telehealth and medication delivery service. Now we are working with across the board and become the largest healthcare website in Malaysia. Essentially, we call it WebMD of Malaysia. And we are working with a number of healthcare payers and insurance here in Malaysia. And glad to be here. Hopefully, I can contribute to the session.
Thank you. Call Sirucek.
Hello, everyone. I'm the co-founder and CEO of DocDoc. We are a kind of a pan-Asia doctor discovery and insurance tech platform company that has been in the business for quite a while. We work with various insurance companies. We work with direct-to-consumers and various employers. It's great to be here and great to speak with all of you.
Thank you. Dr. Dinesh, Dr. Dinesh Jain.
Good morning, everybody. I'm Dr. Dinesh Jain. I work with a company called HealthCare, which is a private integrated healthcare provider company operating mostly in northern part of India. We operate around 14 facilities in different states. I have my background is in general surgery and in clinical informatics. I've been working with the clinical informatics, information systems and data analysis for the last almost 20 years.
Right, thank you. Last and not the least, Nathanael Faibis from Indonesia.
Hello everyone, I'm Nathanael Faibis. I'm the CEO of Alodokter. Alodokter is a company we started with Suchi, my co-founder, in 2014. Today we are a leading health tech company in Indonesia, and we provide basically what we call a super app ecosystem for users all across the country to have telemedicine consultation with doctor, book offline appointment, buy medicine, have access to insurance product from our platform. And we are basically building an ecosystem for more than 30 million users using our platform every month to be able to manage their health fully from a single platform.
Thank you. So let's start with Hazwan. Medical care and healthcare using Western medicine has been in existence in this region, at least for the last 70 or 80 years. And you know, most of the countries in Southeast Asia, we were colonized by people from the Europe. It could be Dutch, British, and Portuguese, and different type of Western medicine was actually brought and introduced by them. So after we gained our independence, we had formalized clinics run by doctors. We had the way that medicine was practiced, which was deemed to be pretty effective. And I think all of us here, especially me, when I was young, well, we used to go to we used to just walk into a hospital, to a doctor, and we used to get treated. There was not really a way of getting an appointment. At the most, you can make a telephone call, and if you're lucky, the line gets through, you get an appointment. Otherwise, you go to a clinic, you wait, and you see a doctor. And everything used to be fine. We didn't see a problem at those times when I was much younger. Now, in your opinion, how do you see that this transition that we have gone through from the old way of doing our life, the way we worked in healthcare, and what you have today on your platform? What do you think the real advantage that you see in this transformation? And also quickly mention if there are some disadvantages, because we always talk about the good things. Do you see there are some disadvantages that you see which used to be there and now we have lost it?
Okay, thank you, Dr. Kuljit. I think I personally, because I'm not a medical doctor, I started this in 2016, really from the patient point of view. There's a few scenarios. Our healthcare system has been great. It works, right? You get sick, you go to hospital, and you go to clinics, and then you get treated. You take medicine, you come home, right? That has been going on for the last 50, 60, 100 years, right? But however, I think with the advent of technology, it didn't start in healthcare industry. It started in other industries where patients are expected to be, customers are expecting things to be faster, easier, right? So it started off, why can't I just ask questions from doctor? Or why can't I just ask this? I just want to know, why can't I snap a photo and send it to the specialist, right? And what you notice is slowly, it didn't start, it started probably like 10, 15 years ago when people start Googling and changing their healthcare seeking behavior. Suddenly everyone become an expert and, start referring to Google, and then becomes a nightmare to the healthcare, to the field, right? When people start self-medicating, ordering own medications and so on, because of this whole overflow of information, right? So that's when in 2016, we start, if you look across the healthcare in Malaysia, it's pretty much untouched by technology, unlike the industries like telco or banking, right? So a lot of technology is used within the hospital. There's no easy way to communicate. So that's when we started. It was not a critical, an alarming need at that point, right? Because when we see a lot of doctors, there's no issue then, to go and see a doctor and so on. But slowly it's becoming the need when people are expecting to be able to reach out to doctors, nurses, make bookings like faster than ever. And of course, the pandemic kind of pushed that behavior a lot faster, when people just want things to be done digitally. So I think that's where this whole the old healthcare, it works, but it is there's a growing concern that without the technology, it might the actual patient care and safety cannot be addressed in timely, right?
Thank you. Maybe I'll ask Cole this question, that what is your view about this acceptability of using digital healthcare? I know the younger ones, not an issue. They love their handphones, they love their mobile devices, they want to be connected, they also want to be connected with their doctor. What is your view on the acceptability of patients and also doctors using digitalization? Do you see there is sometimes some resistance in using digitalization in healthcare? I don't mind buying something from Alibaba or from Amazon. That's different. But now healthcare, do you see there are issues sometimes that people do not want to adapt digitalization for healthcare? What's your opinion and your experience so far?
Surprisingly, very little. Surprisingly,
Sorry?
Can you guys hear me okay?
You are cracking up. We can't hear you so well.
You guys cannot hear me. I'm cutting out.
All right, now it's better.
Surprisingly, we see very little resistance. So we don't see resistance on the doctor side. We don't see resistance on the patient side. The key is you have to be really credible. But this isn't the big problem in the industry. And what people aren't talking about is the rate of medical inflation and accessibility of care and the kind of massive problem working through the system of lifestyle diseases. You know, a third of Malaysia right now is pre-type 2 diabetic. When you start looking at what that means in terms of cost, and you look at the cost of care, the current system is completely and utterly unsustainable, both in that it's not providing enough access and the rate at which a unit of care is increasing in cost doesn't work. So technology is going to have to play an important role. And it's not the consumer or the physician that's really blocking technology. It's the system. It's the insurer. It's the insurer. It's the hospital system that is largely saying, wait a minute, this gets in the way of our existing economic models. You know, medicine has to go through a period of massive deflation in order to expand the access to care to prevent bankrupting governments. And, you know, Southeast Asia, just to give you an idea of the sense of scale, Southeast Asia is 3x the US on the rate of medical fraudulent claims. It's 2x the Middle East. You know, so the system has no choice but to use technology to bring in a large bout of deflation, or you're going to have literal massive instability in the societies.
Good point that you brought up. One question before I go to the next speaker is, like, you know, digitalization may work well in an urban setting. Many of the Southeast Asia countries, we have got a huge population in the suburbs and also in rural areas. How do you see digitalization picking up in such of these areas? Because it works well in a city, but what about suburban, rural areas? Maybe there's no accessibility to broadband and even to smartphones. What's your view on that? And also the level of education, that sometimes we may not be able to get such kind of devices. Do you have experience in that?
Is that question to me as well?
Sorry, did you hear me?
That too?
Yeah, it's for you.
Oh, no, I think I don't think that's that relevant. So we began at DocDoc believing that it was going to be really difficult to convince the average patient to use the system. That isn't a problem at all. The physician, consumers, there's a big enough chunk of consumers that are digitally savvy enough that we don't see any issues there at all. On the physician side, If you're highly credible, that's easy. If you're not credible, they sniff that out pretty quick. And physicians are really worried, are really reluctant to work with organizations that aren't credible in security and privacy, aren't credible in the medical relevance of what they're putting together. But if you're credible, the doctors are actually not that much of a challenge. The challenge is in the infrastructure.
Right.
So telemedicine has taken off. So in Southeast Asia, telemedicine is not a business model yet, right? No one's making money from it because none of the payers are reimbursing in a reasonable amount. And the insurers aren't reimbursing in a reasonable amount. You compare that with like Sweden or Norway or most of Northern Europe, where telemedicine is actually making money, or even in the United States to some degree. They have robust reimbursement. If the government's willing to reimburse at €50 a telemedicine consultation, you can be a telemedicine company and make money. Right now, there is no reimbursement for these digital services that justify their existence. And so it doesn't mean we can't build companies, but we're building companies that don't have economic models yet.
So you see telemedicine is an issue in Southeast Asia. It seems to be working very well in the Western society. That's what you're trying to say, as far as reimbursement is concerned.
In Europe, for example, the governments are reimbursing in a way that allows it to be a standalone model. In the US, the employers were doing that for a while. They've now slowed down on that massively. And this is why you're seeing the US telemedicine companies start trying to aggregate with other kind of pieces of the care journey, because standalone telemedicine is no longer really making economic sense in the US either. In Southeast Asia, it's never made sense.
Yeah, good points. We'll move to Dr. Dinesh. You come from India, a huge country, huge population. What is your view? I'm going to take the same question that I asked Cole just now on digitalization in the rural areas. I can expect in big cities wouldn't be a problem, but you have a huge country. What is your analytic knowledge on spreading digitalization in areas in India, especially where healthcare may not be easily reachable? What is your view on this, what we have currently and how you're looking at the future? We're just going to move on from what we had in the past. I'm sure you have a lot of analytical knowledge on this, and you can share with us on this, Dr. Jain.
Yeah, that's a great question. So let me begin with what Sirucek said, that in terms of the access and acceptability of technological solutions for healthcare delivery. As he rightly said, that there is not much of resistance from the consumer side, rather there is a pull. The consumers, because of their experience with other service providers, which are mainly financial services or telecom companies, they have got used to consuming digital services. And that is what they have started expecting from, and they are demanding it from the healthcare industry also. So we see that there's a lot of pull which is coming from the consumer side. However, from the provider side, there's a different story, because of the fact that the healthcare industry is a lot different from the other industries. You have the issues with data confidentiality, privacy of the patient information, and then you also have issues about the integrity. So maintaining that and having the access of information at the provider end, when and when it is required, that is the issue with the, and that's more of an issue from the technological provider side rather than from the healthcare provider side. So the uptake from the care provider, that has been a little resistance we have been seeing, but wherever we have seen that the right technological tools are provided to the care providers, they are the first ones to advocate for it. And they advocate it very strongly to their patients as well. The patients are ready to accept it. We being a private care provider, we see that there is a lot of technological solutions being used, and especially with the light of the experience with the COVID pandemic, we have seen that the uptake of telemedicine, which was less than 1% of telemedicine medical consultation before COVID, has transitioned to a state where it is now almost 30%. And that is what we have seen in our practice, as well as that's also a study which has come in from US, where they have seen that that kind of uptake has happened for telemedicine. So in that sense, COVID has been a sort of a blessing for the acceptance of the technological solution, which was already there, but there was not much use of it. However, to come to the point where the rural and the suburban populations do they have the access? I think there are still issues with that. We still have gaps in the rollout of broadband services to the rural areas. Even though the penetration of the mobile and telecommunication services to almost entire country has happened, but there are certain gaps where still these services are awaited. So, but on the other hand, what the government of India has done, they have rolled out many programs which are based targeting the public healthcare sector using technology, because they also realize that India being such a large country, it is not so easy to physically access all these services to at every remote location in the country. So that's why they have also tried to use technology, and many of the programs which are including the telemedicine services and ambulance, primary healthcare. So these services have been rolled out on the technological backbone. There is a lot of uptake for these services, and I think that's still work in progress. I wouldn't say that everything has happened for the entire country, but more and less, a lot of areas have been covered so far.
Right, thank you. So is there an issue with cost in expanding digitalization? Is the government of India proactive in coming together to help out in the cost of increasing digitalization? Is there any incentive given by the government to promote healthcare digitalization? Is it an arm of concern that the government is looking at?
Right. So, in fact, I would say that cost has been a driving force for the use of technology by the government. As I said, that physical access is even more costlier for the government to roll out the healthcare services at the remote locations. So they have proactively gone ahead and used technological services to deliver the healthcare services at remote locations. In the case of, for example, in COVID, when we are looking at rolling out the vaccine services, so providing the vaccine is, of course, a physical access. So there's no alternative to it. Even though using technology for managing the supply chain is still something which is being done, but however, the getting those vaccines to the villages and to the shepherds in the mountains, that has to be done physically. But in other cases where some of the healthcare services which can be provided over remote distances, there the government has been very, very proactive. And apart from the public healthcare backbone, where they are using technology, they have also partnered with private healthcare providers to roll out these services. So it has been a win-win situation both for the public as well as for the private healthcare sector, working with the government to roll out these services to the last person in the village.
All right, thank you. Now moving to Nathanael, Faibis. Now, Cole mentioned something about telemedicine that doesn't seem to be as good as what they have in Europe. What's your opinion, and what do you think? What else can we do to get telemedicine at a different level in Southeast Asia? Is it because, leaving the reimbursement part aside, is there also issues with the providers, with the doctors, with the patients, whereby patients in Southeast Asia would prefer to see the doctor face-to-face, the point of touch between the doctor and the patient is more important. What is your experience, especially in Indonesia? I heard that in Indonesia, they have done it quite well comparatively to many of the other countries in Southeast Asia. Maybe because of the size of the countries, because Singapore, Malaysia, you can see a doctor quite easily because the doctor is available in every 10, 20 kilometers. You can actually travel and see a doctor. What's your view on that?
Thank you for the question. So yeah, on our side, I mean, I think that for telemedicine, as you mentioned, it's really different country to country. I think that telemedicine is actually very adapted to Indonesia and Indonesian context. And I think that us and our competitor are doing pretty well. I don't think that we have much to be ashamed of or to think or to to copy from a European counterpart or US counterpart. On our side, obviously, it's a different market. The size of the market will be much lower than what you would have in Western Europe or in the US. But in terms of size, in terms of volume, we will have volume that are comparable to the big US player or the big European player. In terms of volume, obviously, the ticket size per consultation will be very different. But in terms of volume, the volume is there, right? As it comes to telemedicine, what is really important is always who's paying, which is a key part of the ecosystem. And knowing who's paying, then are they willing to pay or invest into telemedicine? So if you look, for example, at the Thai market, it's mostly dominated by the public sector, by the government. If you go to Singapore, it will be mostly dominated by the private insurance. If you go to Indonesia, it's still a market dominated by out-of-pocket. Basically, right? So even though the public scheme is growing, out-of-pocket is still the main payment method for Indonesian consumers. So the question for a company like us is whether out-of-pocket consumers are willing to come with us and basically use the service with us, right? And you will have several reasons why people are flocking to telemedicine. Number one is convenience, even in big cities. So going to the hospital, going to the doctor for small thing or for just a small checkup with the doctor is very inconvenient, while you can do that in a few minutes in a place like Alodokter. And during a pandemic situation, it's even worse, meaning people are scared to get infected while going to the doctor, while here they can have access to a full consultation within minutes in a platform like us. The second aspect is access. So you rightly mentioned that maybe in Singapore or Malaysia, people can have access to doctor anywhere. You have a lot of places in Indonesia. We say most of the country, for example, if you want to see a cardiologist, it's just not possible, right? Meaning that you will have to make maybe 100, 200 kilometers by car to go see a cardiologist. So it's extremely inconvenient. And in some cases, even some islands, you will not have a cardiologist available, right? So that's something that we've seen since the beginning. The access to specialists is very uneven in a country like Indonesia. So telemedicine gives access actually to specialty medicine to a lot of places in a country like Indonesia, right? Third aspect is about price. Indonesia is a country, as I mentioned, that is out of pocket, so people are very price sensitive. And there's a big price discrepancy between online and offline on our side. And the fifth aspect is trust, which is a big issue in the Indonesian healthcare ecosystem. So platform like us, I mean, what we can do in terms of trust is basically trying to get the right doctors in the platform, selecting the doctors appropriately, training them, making sure that they follow SOP, that they are very nice with the patient, and patient as well can review doctors on a platform like us, right? So many doctors on the platform will have thousands, tens of thousands of reviews, which is something that you will have, that will be hard to get offline. And basically you can build trust with a platform like us, you can build trust with customer, right? So in the context of an out-of-pocket economy, which is the case of Indonesia today, and given all the aspects that I mentioned about access, convenience, price, you have the right ecosystem to grow a telemedicine company today in the country. But that doesn't mean that we are, how to say, doesn't mean necessarily that we are better or smarter or that we're doing things better. It's just that the market itself today is ripe for such a thing, right? Obviously, if you have a market dominated by private insurance, then you need to either become an insurance or you need to convince insurance to invest heavily in telemedicine. If the government is dominating the healthcare market as well. Same thing, you need the government to invest and make sure that it will happen. On my side, I think that, as it was mentioned by Cole, right? I mean, when we look at the level of fraud that there is in the market, the level of waste as well that there is into, let's say, over-testing, too much procedure, over-prescribing. Telemedicine, I don't believe is going to become a luxury, but it's going to become a need for any healthcare system to basically survive. People are aging, chronic conditions are increasing. Managing a case for telemedicine and triaging a case for telemedicine is way cheaper than managing a case fully online or fully offline, sorry, today, right? So basically, ecosystem, whether it's out-of-pocket, insurance-based, or public sector ecosystem, I think we'll have to make the shift to get telemedicine at the core of the healthcare experience, right? And I don't believe it's going to be a luxury, a choice. It's just that healthcare ecosystem that don't make this move, that make this shift, will not be able to manage cost as efficiently that ecosystem that put telemedicine at the core of their experience.
So do you have issues getting telemedicine incorporated with some hospitals, with some doctors? They feel that that probably is not the way. They don't get paid fully because, you know, in telemedicine, you just consult, you don't examine the patient. There is no income in imaging, in doing surgery on the patient. Do you have some resistance from doctors and hospitals? Or are there issues with some infrastructure that telemedicine sometimes has got its limitation? Do you face that issues with, and then certain group of doctors are okay, some group of doctors do not want telemedicine at all. Do you have that issue?
Yeah. So you will have two types of telemedicine, right? I mean, you have the telemedicine that the doctor will do with their own patient, and you have telemedicine that is basically doctors that will just address most people in the country, right? And that don't necessarily know the patient before and just build a new relationship on the platform. So we are more on the second side of telemedicine on our side, meaning that you will come in Alodokter and you will not necessarily speak with your doctor. You will mostly speak to a doctor that can be anywhere in Indonesia, right? So because we're working this way, we don't necessarily need to convince everyone. On our side, we need to convince enough doctors to join our platform and work with us. And today we have a lot of demand from doctors, especially young doctors, to come to our platform, right? So obviously some doctors would not want to come, but we don't necessarily see that as a problem, right? I mean, like what matters is that we have enough doctors and we have quality doctors on our side. Why doctors like to work with telemedicine? Number one, you have a lot of flexibility, right? You can work from home, you can work anytime, you can start when you want, you can stop when you want, which is something that is much harder in a clinical practice. That's the first aspect. So it can be a good additional revenue for doctors. Number two, what we see more and more is that telemedicine is an amazing way to build your reputation. So building a reputation as a doctor can take years, if not decades. If you work in a platform like us, you can build a reputation in the matters of months, basically. Because you have access to patients all over Indonesia, right? You don't have access to only patients around you. You will have patient access to all the country. You will get reviews, people will speak about you. There will be word of mouth, and we see a lot of doctors able to build a reputation very fast, right? So maybe let's say for a very experienced doctor with a lot of number of patients, they may not necessarily be interested with telemedicine. But we see that for young doctors, and by young doctors, I mean doctors that will be below 50 years old, right? Not necessarily very young. That can be a great way for additional revenue and also building a reputation online on the platform. As it comes to the limitation of telemedicine, definitely there are limitations today. That's the case. That's the reason why Alodokter we connect as well our system to offline booking systems, so that when you need to go to the hospital, you can go there. You can have a follow-up consultation with us as well. We are partnering more and more as well with lab test companies so that you can get your lab result and connecting them to Alodokter, so that not necessarily you need to see a doctor, but you can still get lab result that will be seen and reviewed by a doctor. And you also have something that's going to happen a lot over the next few years, which is the development of remote diagnosis technology through smartphone. So I think that one of the big revolutions that's going to happen over the next 2 to 5 years is that not Alodokter, right? But we see a lot of companies working on creating ways to do remote diagnosis from your smartphone. That may sound like science fiction, but you have more and more FDA-approved technology doing that today. And the challenge for telemedicine company will be to integrate with those technology, and they will enable basically to do a lot of things that you will have to meet face-to-face through your smartphone. So you may not necessarily be able to do everything, but from what I see the progress of this type of technology over the last 2 years, I believe it's going to completely revolutionize telemedicine over the next 5 years, right? So the way I see things is that in 5 years, most of the diagnostic that you will be able, that you have to be face-to-face to be doing, you will be able to do through a smartphone. And that's going to happen. Teams are working on it. Some of them are very advanced on stuff that is very, very surprising. And additionally of that, connection with lab test company, lab test facility enables you as well to have all this hard data on that side. So the move of telemedicine is going to be only about soft data to hard data. And I believe it's a revolution that is going to happen over the next 5 years. And that's going to make basically telemedicine as just medicine and not a lower type of medicine that you will do on the side.
Thank you. All right. Now we're going to go into the second round where we're going to talk a little bit about the future. So Hazwan, right now you do have this portal where, you know, if I would want to see an ENT doctor, I must say ENT because I'm an ENT surgeon myself. So I go onto a system and then you find a doctor for me, then I see the doctor accordingly. But don't you think so in the future, we should have a system whereby my electronic records are kept with me and the doctor who I see today, based on this platform, will be able to access on my history? Because like today, if you give me an appointment on your platform to see a doctor for whatever ailment that I have, I will have to explain to the doctor in detail what I had, who saw me before, what are my medications. So eventually the whole consult becomes a very disjointed, not so complete. What do you see in the future whereby we can have something more robust?
I think this is because the title today is data and technology, right? So when it comes to data, traditionally, the problem is the data never followed the patients, right? It's always stuck in the hospital or clinic. And if it's stuck in as a electronic medical record, is actually one step up. But in a many, say, primary healthcare setting, the data is actually in a cabinet of pen and papers in files, right? So that data will always be kept there, will never follow you. So I think the first thing that we are trying to advocate is actually the data must follow the patient, right? In order to do that, so you imagine like in Malaysia, we have hundreds of hospitals. I mean, to say that, okay, all hospitals should share data, it's actually, it will never gonna happen, right? Then I think we need to start looking at how the patient can sort of organize their own data and provide it to the healthcare professional, right? So everything from their lab reports, their vitals, their remote sensors and whatnot. Those are the data that can easily be organized by the patients and then provided to the healthcare professional. And the other thing is connectivity, right? So once all this data is organized, right, it doesn't, ideally, yes, you should go back to your, so sorry guys, I have like kids in the background. For the data to be, once the data is organized, the other aspect is connectivity, right? So sometimes in the traditional setting, we see a primary healthcare doctor in KL, and you suddenly get sick in Penang, and then you go see another doctor and you start over, right? But the key here is like, you know, what if the doctor in Penang, primary healthcare doctor especially, can see what was prescribed to you before, what was given to you, your basic healthcare data, it will make their decision making a lot easier, right? So that connectivity is one thing, and connectivity between as well as connectivity between online and offline. Say you see I see you online, and then when I go see you in person, you have both data integrated. So that is something that we are advocating and working towards, so that this whole ecosystem, the whole telemedicine works. Right.
Thank you. Cole, something interesting which I would like you to tell us, whether will it be possible in the future? See, right now we have issues with the reimbursement, issues with the insurance company. When I try to operate on someone, I will have to get the insurance company convinced that this particular reimbursement has to be done. It is back fought and it becomes troublesome. I'm not sure whether it's only peculiar in Malaysia. It could be peculiar in many other countries. Do you see digitalization and sharing of data using technology in the future, that the moment a patient sees me, the insurer is already with you online, in order to make it seamless, so that every data that you punch in, the insurer will have artificial intelligence kind of method that your reimbursements are done almost immediately using this technology in the future? Because today insurance players are very separated from the doctors and the clients. They work very separately, and sometimes I don't know whether you know this, they can dictate a lot of ways the way medicine is practiced. Do you think technology can help to weed these kind of issues in the future?
This is where technology has to go. So there's many different speaking across purposes here, but when I was making the comments earlier about telemedicine reimbursement and what that actually means for business models, this gets right into what you're talking about in terms of what are governments, what are insurers willing to pay for, and what are they getting? There's a huge problem in the industry, in that the insurance industry, in the medical insurance complex, in that the insurance industry is largely flying blind. So they tell everybody, hey, look, we have a lot of data, we have all these claims, but all the claims are stored in like a PDF format. And the claims review is largely a doctor whose job it is at the insurer to actually add a little friction in the system and see where they can save costs. This is a giant waste of time across the board, because these issues about trying to determine medical necessity, this should all be done algorithmically, right? So, but that requires the insurance industry to make a big move. And I think this is where you're going to see technology play the most role, is I think you're going to start seeing, I don't believe the here's what I think is going to happen. The regulators are going to start insisting that the insurers upgrade their information technology. And as they do that, they're going to force the hospitals to have a greater level of data exchange between the hospital and the insurer. This will enable the insurers to start using algorithmic-based determinations around medical pricing, if a price is usual and customary, if something's excessive defensive medicine. And that's how you're going to start getting a lot more price discipline in the medical market, and that's where a lot of deflation is going to come from. I think the idea of online telemedicine juxtaposed with greater diagnostic features remotely, that is going to be a big deal. It's for sure going to be a big deal. I was just evaluating a startup to invest in that seems to have cracked the blood glucose monitoring business without actually having to prick a finger. So you can wear a watch and they can use infrared to determine blood glucose for diabetics. Well, that's a profound, if that really is working that as well as the blood glucose readers of old, that'll have a profound influence. So they can read oxygenation, they can read blood glucose, they can read blood protein. Pretty quickly here, you're going to start wearing a watch that's as good as a big chunk of what you're doing in the hospital. Now, what that means for telemedicine, I'm not convinced. So, a comment that was made earlier, and I think it's very legit, is that telemedicine, if it becomes the care delivery beginning platform, can radically reduce cost. But you see all the hospitals in Southeast Asia, the way they're set up, is they've established relationships with primary care clinics, and the primary care physician is basically a lead generator, profit maximizing engine for the hospital. And so telemedicine playing that role is disrupting the healthcare system model. I think the hospitals are going to fight back on that. I don't think the hospitals are going to want to see a lot of that primary care pathway virtualized. So we're going to have channel conflict in the next few years around this. It'll be interesting to see how it plays out. I think the technology has to win, but that channel conflict's coming down the pipe for sure. It'll be interesting to see how it plays out.
Thank you. Good comments. Dr. Dinesh, what is your view in the next 10 years as far as digital healthcare is concerned in India and globally? What would be your wish list that you are looking at in 10 years from now? I hope we don't have another pandemic in between to teach us more lessons, but what we have gained right now, what do you think we should get ourselves prepared using digital technology in the next 10 years?
Right. So you're right that we should not wait for the pandemic to change our ways of working. And there has been a lot of developments, I would say, in terms of use of technology and technological uptake in the last 1.5 years, in no small measures being driven by the COVID pandemic. So what we have seen is that there is a lot of use of telemedicine, which I think everybody has been talking about. There are issues with the regulatory policy frameworks in many countries. A lot of clarity is still required, but nevertheless, there is a greater use of the technology for the delivery of services in the scenario of the pandemic, when the person-to-person contact was so limited. And also what we saw in our second wave, which happened in the early part of this year in India, that was a situation where there was reluctance on the part of the patient to move out from the hospital, from their homes, and the doctors were also reluctant to see new patients. So in that scenario, telemedicine was a savior. The patients could access the healthcare from the comfort of their home using the telemedicine framework, by which by that time most of the healthcare providers had already instituted and they had rolled out since last year. So that framework was in place, and the patients were using that to the full advantage. So that is something which helped in no small measures. Another thing in many areas that we see, like for example, that COVID wards were set up, hospitals were converted for COVID patients. Now, within that COVID inpatient setting, there was still that the quarantine rules allowed that the patients had to be cared by a limited number of doctors who had to be quarantined from the rest of the populations during the time they were involved in the care of the patient, and 15 days after they were relieved. So that led to a lot of deficiency in terms of the number of physicians who were available to take care of the patient. So that also was helped by the remote care, where the senior doctors may be sitting at his home or at his chamber, was able to have a feel and examination of the patient, and to converse with the doctor in the ward to direct the treatment of that patient. So that was something again where the technology helped. And also in no small measure, the electronic documentation system, the record keeping, which many of the hospitals have in place. So that helped. The research that we were doing in terms of COVID patients, that demanded that we have to have the real-time access of the medical records of these patients, happened seamlessly because of the fact that whatever was being seen by the doctor on ground in the COVID ward was immediately accessible to the researchers and to the doctors working on the COVID population. And that was in turn reported in the media and to the government. So that was something which helped. Another was that the non-essential manpower, which was the support manpower who didn't have to come to the hospital to see the patient, they could work from home using the remote working. That happened. We saw that the change in the infrastructure which was required because of the influx of the COVID patient, that led to a change in the workflows, led to a change in the patient movement, the waiting area, how the patients are going to move and wait in the hospital. So all that happened apart from the telemedicine. And then there you had another level of change that was happening, which was that re-engineering of the existing facilities happened. So you have the airflow management engineering, which had to be overnight had to be changed depending on what are the areas that you are converting to COVID areas and what are the areas which you are keeping for the non-COVID patients. So these had to be segregated. The people who are going to come into the hospital and move out, they had to be managed and regulated in such a way that they are not going to cross their paths, and there is minimal collection of patients in one place. So all this was happening simultaneously, parallelly at that time, and that I think has taken roots. These things are not going to be reversed. A lot of things, what we have seen in India, being a highly populous country, any service point of delivery you go, you see a large crowd of people coming to who have come to take these services, and then you have a situation which is not actually conducive in times of COVID. So you have these re-engineering which has happened, and that has helped change the way that the people look at the service providers and how the service providers are going to deliver their services to you. So all that has changed, and I'm sure that a lot of new developments we are going to see them in the next coming years, where we will see the change from the existing models of service delivery to a new form. So I'm sure, I'm very optimistic that we are going to see more and more use of technology in these areas.
Thank you. Fantastic. So we have a final question to our final speaker, because we are another 5 minutes away, to Nathanael Faibis. Now, okay, because of this COVID, I probably watched a lot of Netflix because there's no social activity. The only social activity I have is Netflix. Now, do you think that in the very near future, using Internet of Things, telemedicine is going to take a step forward? Like, I'm just imagining, let's remove all the bureaucratic work. Can I get my patient in Kuala Lumpur or in Jakarta get operated using 5G technology, using a robotic from Mayo Clinic or from Johns Hopkins, United States? The top person in Johns Hopkins or Mayo Clinic or anywhere in the world, even in Europe, to operate on our patients using robotic technology, or even having a long distance consultation on a lot of other areas where you need a little bit of physical work, whereby the surgeon doesn't need to fly in. Do you see this will ever happen, or is only going to remain in Netflix? Do I have him here, or he's watching Netflix?
Who are you asking?
I'm asking Faibis.
Yeah.
Nathanael Faibis. Did you hear me?
Yeah, I heard your question.
Right.
So I'm not sure. I mean, we are not dealing directly ourselves with operation, technology of operation. So I can't tell. For sure, there's at the moment like a lot of restriction of transnational care. I think in most countries in the world.
If that is allowed, I mean, we leave that part of it out of the equation. Do you think technology is going to help us out in that way?
It's possible. It's possible. I hope that Indonesia will be able to train our doctors to be able to do it on its own. On our side, I guess there will be a possibility. Seeing that we are still very far from it. Obviously, you will still have the language barrier, which is a big one. When you want to understand the case of a patient, you need to speak with him. And even if you have like robot that perfectly translate things. You may not understand the context as well of where the patient coming from, what is the habit, what's happening when they say something, what does it mean, and so forth and so forth. So I can't tell for sure today. I guess that we still a bit far from it, and I guess that there's a lot of things that are simpler to be done with smartphone. It will happen first before we move to let's say globalization of healthcare procedure through 5G or Internet of Things. But theoretically, I guess that there's no reason why it will not happen one day.
All right, thank you very much. So we are almost at the end of our time. I would like to take this opportunity to thank all of you all. Well, we come from diverse backgrounds. That's the best kind of information we can share with each other. It was very enriching. And once again, I would like to thank the organizers for organizing this event and also inviting all of us. Back to you, to the MC. Thank you very much.
Thank you to Dr. Kuljit and our esteemed panel members for that captivating conversation on healthcare, its advancements, as well as challenges such as real-time data and insurance claims that come with the shift towards more technology adoption. With that, we have concluded the first half of Day 3 at the Digital Ecosystem Week here at Malaysia Tech Month 2021. We shall take a break now and for our sessions and resume later at 2 p.m. See you all later on. Thank you.
Thank you all. Take care.
Right.